Hello from the World Economic Forum in Geneva. My name is Adrian Monk and welcome to this 2020 Global AIDS Update to launch the annual report Seizing the Moment. Delighted to be joined here in the studio by Winnie Byanyima, who is Executive Director of UNAIDS. We have joining us as well from Eswatini, the Prime Minister, His Excellency Ambrose Dlamini. We also have from Bolivia, Violeta Ross, who's President of the Bolivian Network of People Living with HIV and a board member at UNAIDS. And of course, you and your questions. Just as a point of information, this briefing is embargoed until 1600 hours Central European Summertime, which is 1500 BST, and we'll be using the Q&A function for questions. So thanks for using that. I'm going to hand over straight away to Winnie. Winnie.
Thank you, Adrian, and thank you, World Economic Forum, for hosting the launch of our annual global report on HIV/AIDS. And thank you all for joining us. This year's report, we call it Seizing the Moment, Tackling Entrenched Inequalities to End Epidemics. As you can see, there's an S at the end because we are in a crisis, a health crisis globally of COVID-19, and we also have an HIV/AIDS epidemic still going on. Our report shows remarkable but highly unequal progress. Progress is happening, but highly unequal. It's mostly in expanding of access to antiretroviral therapy, but because achievements have not been shared equally within and between countries, the world is not set to meet the targets for 2020. Targets can be reached if we pay attention to where progress isn't happening. Sub-Saharan Africa is the region making the greatest progress. Has the highest burden, but makes the best progress. New infections in that region have come down in the last 10 years by 38%, higher than the global average of 28%, and then of 23%. And some countries, like Eswatini, Your Excellency Ambrose Dlamini, your country, hit hard by HIV, is one of the best performers because it, South Africa, Lesotho, have used a combination of HIV prevention, treatment, combined with special efforts to reach the most vulnerable people, the most at risk, to bring down the incidence of HIV. So it can be done. We see rich and poor countries that are determined achieving the targets. Eswatini has way past the 90 targets and has achieved 95. The Prime Minister will tell you about that. In 2019, last year, we had 1.7 million new infections. Imagine, 3 times more than the target of 500,000. Not acceptable. But we see that new infections are coming down in Sub-Saharan Africa, but going up in Eastern Europe and Central Asia, going up in MENA, Middle East and North Africa, and going up in Latin America. That's disturbing. And the trend is mostly amongst key populations, what we call key populations. These are people who are highly at risk: gay men, sex workers, people who inject drugs, migrants, groups that are, because of their particular lives, are more vulnerable than others. We see that criminal laws make it worse, particularly for these groups. In more than 106 countries, drug use, personal drug use, is criminalized. In 73 countries, gay sex is criminalized. Sex between people of the same gender is criminalized. But we see progress. Botswana this year repealed a law criminalizing gay sex. Gabon, only last week, the parliament has struck out this law, and we're waiting for the Prime Minister to sign on, the President to sign on. So there's progress, but we have a lot of work to do. Deaths, 690,000 people died last year of AIDS-related illnesses, in spite of the fact that we have got prevention tools and we have got treatment to put people to live a healthy life for a very long time. It's coming down, but again, above the average, the target of 500,000. 95,000 of the people who died were children. That's heartbreaking. We have 25.4 million people now on treatment out of 38 million, but that means there's 12.6 million still not on treatment. So our work is there to be done. In Africa, I'm sad to say that 4,500 girls, adolescents, and young women were getting infected every week. And the deaths are mostly amongst women and girls. So there's much to do to remove the structural barriers and the inequalities that drive the higher vulnerability of girls in Africa. I want to conclude by saying, over the years, we've seen resourcing for HIV falling. In 10 years, it's fallen by, no, from 2017, it's fallen by 7%. We have a gap. We have a gap of $7.6 billion globally. Some countries have increased their funding for HIV. South Africa almost fully funds its own HIV response. Donors like the American government have increased their resourcing in the last 10 years, but some have, the commitment has been waning. So there is a call to both governments to increase their investment to fight this disease. It is achievable. We can end it by 2030 only if there's a political will and the resources and the space, human rights space, for people to claim their rights. We can achieve it. We want the donors to remain committed to fighting both epidemics. Our report shows that COVID is threatening to throw us even more off course. COVID is a disease that is claiming resources, the labs, the scientists, the health workers, away from HIV work. We are happy that those who have the capacity of HIV are able to fight COVID, but we want governments to use creative ways to keep the fight going on both. One disease can't be used to fight another. I want to pause there and let my co-panelists also contribute, and then we'll take questions. Thank you.
Winnie, thank you very much. You mentioned the progress that Eswatini's made in tackling this HIV epidemic, and delighted to have joining us the Prime Minister of Eswatini, Prime Minister Dlamini. Prime Minister, can you bring us up to speed on the progress that you've made to date in tackling AIDS and what you're doing to keep moving forward?
I am pleased to join you all today for the launch of the 2020 UNAIDS Global Report. This report comes at a time when we are confronting two pandemics which have shaped modern life. The AIDS pandemic changed the world in many ways 40 years ago. Today, the COVID-19 pandemic is changing society and the way we relate to each other. However much as the world's attention is rightly focused on COVID-19, we must not forget the AIDS response. There is much to do and it must be done soon. We can and will end the AIDS pandemic. I am particularly pleased to be with you today because Eswatini is a shining example of what can be achieved when we put our minds together. The kingdom once lived through a wave of increasing new HIV infections and many people dying from AIDS. Today, the kingdom is proud that the UNAIDS report shows that we are on course to end the AIDS epidemic by 2030. Our success comes because of the extraordinary and innovative efforts taken by the country over the years. Eswatini has well surpassed the global target of 90-90-90. In fact, we have achieved the 95-95-95. This means 95% of people living with HIV in the kingdom know their status. 95% of all people who know their status are accessing HIV treatment, and of the people on treatment, 95% have achieved viral suppression. We've drastically reduced AIDS-related deaths by 50%, from 6,600 in 2010 to 2,300 in 2019, and reduced new HIV infections by 50%, from 13,000 in 2010 to 6,500 in 2019. As a country, we have been able to mobilize and reach young men who have played a significant role in breaking the cycle of new HIV infections. We have introduced innovations, programmed our approaches to ensure that we tailor our responses in the right places. Our communities have taken the lead and they have helped to shape our response. But we cannot rest on our successes. We must ensure that no one is left behind. We must close the gaps. We are aiming for 100, 100, 100 in the coming years. We will expand. Our programs on voluntary medical male circumcision, programs to reach young women and girls, bring more innovation to HIV prevention efforts, and transform gender relations. We have not done this alone. The Kingdom has received support from our partners, such as PEPFAR, Global Fund, UNAIDS, and other development and bilateral partners. It is important that AIDS response drive continues with the principle of global solidarity, shared responsibility. The COVID-19 pandemic response can learn from the AIDS movement. We must apply the lessons learned, and we must eradicate inequality. Everyone has a right to health with dignity and respect, and we have a collective responsibility to make it happen. So the Kingdom of Eswatini is already looking at post-COVID-19, and we are looking at leveraging of the gains and the experiences we've had on the HIV and AIDS response over the years. And we think that if we do that, we should be able to deal with the COVID-19 pandemic going forward. Thank you.
Prime Minister, thank you very much. We can turn now to Bolivia and hear from Violeta Ross, who's president of Bolivia's network of people living with HIV. Violeta, can you tell us a little bit about your experience and also what this report means to people in your continent?
My name is Violeta Ross. I am from La Paz, Bolivia in South America. I am an anthropologist and a woman openly living with HIV. I am also a rape survivor. When I tested HIV positive in 2000, almost everyone with HIV died very young. We had to fight for our lives. In 2002, together with other 50 people living with HIV, we took the Bolivian government to a human rights court demanding access to treatment. In 2004, when we won the case, only 27 of us were alive, and today only 7 of us are still here. Since we won that case, I have witnessed tremendous progress in the AIDS response in Latin America and globally. However, many of these gains are now at risk of disappearing, as we have seen in the last 3 months. Since March 2020, while most advocates like myself were in quarantine, we watched with great concern how resources for HIV and other diseases were redirected to the response to the coronavirus crisis. In Bolivia, my country, I saw how HIV medications, testing equipments like GeneXpert machines, resources of the Global Fund to fight AIDS, tuberculosis, and malaria, and also health staff previously assigned to HIV were moved to the COVID-19 hospitals. Before the COVID-19 outbreak, Latin America was already left behind. Being categorized as a middle-income region, we were not a priority for most international donors, some of which were already transitioning out from this region. This has had a direct impact on the HIV response. As stated in the new global report launched today, Latin America has had a 21% increase of new HIV cases since 2010. Now, as Latin America is the new epicenter of the COVID-19 pandemic, we face the risk of falling further behind. I have deep solidarity for every person who are getting infected with COVID-19. However, as someone who had to fight for medications, resources, laws, and policy reforms for the last 20 years, I call upon UNAIDS, governments, donors, and every stakeholder gathered in the International AIDS Conference to rescue, protect, save, and maintain the gains of the AIDS response. We cannot be left behind. HIV cannot be left behind. Latin America cannot be left behind. Those of us living with HIV, of course, we know the challenges of a life with a virus, and that is the reason why precisely we need to demand the continuation of HIV care and prevention services. Thank you.
Violeta, thank you very much indeed. Time to turn to some questions now, and thanks to our panelists for staying with us. Trying to go to Kuntenya Senior from India, if we have Kuntenya on the line.
Super. I have two questions. One for the UNAIDS director is, what are the numbers for India? How bad are things? How many infections per week? And with the numbers of COVID going up every week in India, now we are number 3. We have almost 21,000 cases per day. How much do you think that's going to really affect the HIV movement and prevention in India? And the second question is for the Prime Minister. What are the things that India can learn from your country as far as HIV is concerned?
Thanks for that. Winnie, can I turn to you first?
Yes. I don't have the numbers for India on me right now, but we can send them to you. But the region, the Asia region, we are seeing increases in new infections, and this is mainly amongst the key populations. It's among gay men, it's among sex workers, it's among migrants, it's among people who inject drugs. Now, we also know that for India, with COVID, in the first 2 weeks of lockdown measures, that violence against women and girls went up, the reports went up by double, they doubled, showing that a pattern, actually it wasn't just India, we also saw the pattern around the world, that girls and women were not safe at home with the lockdowns, and that violence is increasing. And our research shows that where there is more violence, that is where you also get new infections amongst women and girls. So we are concerned about the violence and the lockdown measures. We also saw in India with lockdowns that many people, particularly migrant workers, had to walk miles and miles and miles without food, trying to get back to their homes because there hadn't been sufficient planning ahead for what's going to happen to these vulnerable groups if you lock down everybody at once. So serious concerns, like Violeta has said, of services being disrupted. We're seeing that too, services being disrupted, and people living with HIV suddenly finding that what they fought for, as Violeta put it, is slipping away from them suddenly. This is also an experience in India.
Thank you very much. Prime Minister, can we just put to you, are there lessons from the experience of Eswatini that can be applied to other countries like India, for example?
In Eswatini, the HIV and AIDS situation was in the beginning was very, very tough. One of the challenges we had to deal with was the stigmatization, where if you had this known to have HIV and AIDS, you were really, really, not welcomed in society. So one of the things that we had to deal with very quickly was to teach the population that if you are positive, you have AIDS, you shouldn't be stigmatized. And we tried to normalize and make sure that people living with with the virus were acceptable in society. And it took a while for that to happen, but we did a lot of excuse me, education about the disease. We also used people who are significant in society who were positive to start, talk about this pandemic openly, and that really helped a lot because people, started opening up as well. There was a lot of focus on the national response. They were very aggressive on the national response programs. One of the things that we did, which really worked for us, was to take this to the grassroots level, where we used the local chiefs and local authorities to be part of the response in terms of education. We also integrated this with the schools, so that we could target the young people, educate them very early about the disease. So that also really helped a lot. And as we speak, HIV and AIDS now is basically in the country regarded as one of the diseases. We've done away with stigmatization, and the level of acceptance is now very, very high. And my experience is I come from the private sector. So before I came into politics in 2018, and there was a lot of work that we did in the private sector. In fact, I was chairing I was chairing the HIV response in the private sector in the kingdom. And we did a lot of work, even in the workplace, to try and promote, testing and education on this disease. And that really transformed the corporate place or the workplace to a point where it really became normal to have this pandemic.
Great example, Prime Minister. Thank you for sharing that. I'm going to turn to Johannesburg and Kim Harrisberg from the Thomson Reuters Foundation. Kim.
Hi, thank you. Thank you for this briefing. My question is whether COVID-19 has backtracked progress made in tackling HIV for women and girls, and if so, how? Thank you.
Well, thank you for that question. Certainly it has. COVID-19, first we heard about services being taken away. That is important, and we are monitoring this. We're seeing, first of all, disruptions in manufacturing. 80% of treatments are manufactured in India, for example. But we are seeing that there is backlog, a demand for production for commodities for COVID, and now we are monitoring and seeing delays in getting products to countries for people who need HIV commodities. That is one way. And that we are pushing hard to ensure that companies don't drop the ball on HIV commodities. But secondly, lockdowns. Lockdowns, as I said, have brought a higher risk of violence against girls and women, intimate partner violence, domestic violence, and violence in other places. That itself increases the likelihood of infection amongst them. Third, millions of girls are out of school today. They are at home. Millions of them may never return to school, either because they've been abused and have become pregnant, or even just the cost of school fees being not there. And we have a culture in many of our countries of son preference, with incomes now completely cut, with people without jobs, you may expect that girls will not return even when boys return to school. So those are risks to girls. So we have a range of risks that come from the structural barriers, but it's the inequalities between boys and girls, between men and women, that are increasing their vulnerability with a second epidemic. We are monitoring, but we are also working on the ground with women's organizations, with communities of people living with HIV to demand rights matter in fighting an epidemic. It's not just a health issue, it's an issue of rights. Rights matter, and we work with communities to insist on everyone's right to health.
Thank you, Winnie. And perhaps we can also get a perspective from Bolivia, from you, Violeta. Has this pandemic really hit hard on efforts to get women and girls treatment for AIDS?
Yeah, I was going to say not just for women and girls, but also anyone living with HIV who was living in the rural areas. It was very difficult to move around and collect the medications. Not even ambulances were provided by the AIDS program, at least in my country, and I know a lot of this has been true in many Latin American countries. How to move to pick up your medications has been a direct impact of this COVID-19 pandemic. What we came to call the COVIDization of health. Ministries of health are now talking about health finally, and presidents and even other health other authorities in the countries, but everything is focused on COVID, as if we have finished the HIV epidemic, and tuberculosis is suffering the same. So we are being diverted, we are being forgotten, we are being really left behind. And this has a direct impact on women and in every person living with HIV. I would also say children had a very difficult time these days because children could not go out, and they need special services, and some hospitals are already closed because of the risk of COVID. So it is not easy. It's going worse on my perspective. And what the Prime Minister said, what we have gained in HIV, it was a lot, it is a lot, but the risk is now that we are losing this in weeks, in months of this COVID pandemic. We are facing the risk of losing everything, and that is my concern. And I know that is a concern for many people living with HIV around the world.
Winnie.
Let me come in again about the impacts on women and girls. You see, lockdown measures were brought in without thinking through the impacts on different groups of people, because every epidemic thrives on inequalities. And unless you're tackling those inequalities, you make it worse for vulnerable groups. So if you think about it, in many, many countries, either in Africa or South Asia, low income or even lower middle income countries, majority of women are working in the informal sector. They earn their incomes on a daily basis, many of them. And when you just have a blanket lockdown, you've locked down their ability to put food on the table for their children, their ability to fetch water for all this hygiene and washing hands several times a day. In Africa, a woman walks 6 kilometers on average to fetch water. Now you're saying wash hands every 5 minutes, every 10 minutes. Who's going to carry that water? It's women and girls. So you see that the burden of care in the families, the incomes of people in the informal sector, majority of whom are women, have been taken away. And social protection came in too little, too late. A little food here, but not much for families to live off. So you see the impacts, increasing vulnerability to HIV, through directly, but also through taking away of livelihoods, blocking transportation, and so on. So we are seeing gendered impacts here.
Thanks, Winnie. We have questions coming up from Paul Adepoju from The Lancet in Nigeria, and also from Venance John from radio in Tanzania. Perhaps we can hear from Paul first and then get the question from Venance John. And Paul, you're on.
Yeah, thank you very much. I have a question for the executive director. Do we have specific information on how COVID-19 has had direct impact on donor funding for Africa's HIV program? Then I also have a question for the Prime Minister. If there is any lesson that the state of the COVID-19 pandemic has shown Africa and several other parts of the world, is the fact that there is minimal success to Africa's disease-specific approach to control programs. While Eswatini is one of the African countries that are making great strides in controlling HIV, the focus will go to another country that is making progress on tuberculosis. And when we want to talk about COVID-19 to be another disease, so from your perspective as Honorable Minister, what are you doing to ensure that when a new disease, when a new pandemic arises, African countries are able to rise up to occasion? Thank you very much.
Okay, thank you for that. And Venance, John, can we just get your question, please? And I know you're just on the phone.
Thank you very much. I would like to ask Director Winnie Byanyima that according to her report, show that sub-African countries have managed at least to tackle HIV/AIDS. Then can she tell us what made such success to be so? Thank you.
Thanks for that. So just to put those questions together, in the first case, Winnie, donor funding, has that been affected by the current crisis? And then also Venance's question on the successes.
Thank you. We are monitoring. It's a bit early to know because most governments have already locked in their budgets for this year, and we may see some funding remaining there for this year, but we could expect cuts in the coming year. But let me tell you something. For the low-income countries of Africa, we have reason to worry very much. They are funded almost 90% by aid money, the AIDS response. This is disturbing because we know that those very countries have been hit very hard, the donors. They have got to recover their economies, and the revenue they will raise will not be what they expected. So even if they said we are going to keep the level of ODA where it is, say 0.7 or 0.3, whatever the country has been giving, in terms of real volume of money, it will be less money. So the dependence, the high dependence on donor resources by many low-income countries is worrying because they will need to find ways to plug a gap if they get less money, which they will, considering that there are other health needs, and it's not likely that HIV resources will increase against other needs. So there is a real concern about donor resourcing. But let me also say something, that many countries are moving towards fully financing their own epidemic, and that's good. We also need to understand that some countries are not succeeding, not because of lack of resources. Let me give you an example. Indonesia is a middle-income country. It has rolled out a national health system that gives insurance to people. So they've moved towards universal health coverage, and we praise them for that. But yet, it is one of the top 5 countries with the highest numbers of deaths, AIDS-related deaths. Why? Because HIV is very much amongst vulnerable groups who do not matter enough, whose human rights are not guaranteed. So human rights are so important here. If groups that are vulnerable are not considered equal, their right to health is not considered, you can continue having high levels of deaths, even new infections, while you are saving other lives, but you don't value other lives. So human rights are critical here, giving everybody their right to health.
Winnie, thank you. And Prime Minister, can we turn to you on that question of preparedness for the next pandemic waves. How are you and your country looking at that potential threat?
Thank you very much for that question. Let me, before I get to that question, just give a quick view on a question asked earlier on the impact of COVID-19 on HIV. One of our biggest worries when this pandemic started 3 months ago was because of the high prevalence rate in Eswatini. HIV was we are at 27%. We were really worried that, you know, with so many people in the country living with HIV, how is this new pandemic going to impact them? What has really been comforting is that we have seen a lot of people with HIV and AIDS who have contacted or were infected with COVID-19 recovering quite well. In fact, our recovery rate at the moment sits at about 57% on COVID-19. So that so far has been a huge relief, because we were worried that perhaps those people living with HIV will be adversely affected because they already have a virus. So it has been quite comforting. Coming to the question, I must be honest and really frank that, you know, Eswatini at this point is not really fully ready and fully equipped to deal with pandemics. But what we've learned is that, you know, through the HIV and AIDS response, we've developed some capacity that we think we are going to leverage on going forward. One of our biggest challenges is obviously lack of resources. And I think the comment has been made earlier that developing countries are going to struggle even more, because one of the decisions we've had to take as a country was to redirect some resources targeted at HIV and AIDS towards COVID-19, and it will definitely affect our response on HIV. However, the plan going forward is that we are going to use the national response framework, which has really done well. In fact, that framework is the one that has given us all these gains over the years. We want to basically use that and develop it so that it can equip the country to deal with future pandemics. And that is really the strategy going forward, and we put more resources and make sure that that national response is able to deal, because right now it is responsible for HIV, for malaria, and TB. So those are the main diseases that is being managed by the framework, and we think it is really doing quite well in all of these diseases. We've been able to manage them quite well, and we think going forward, all future pandemics will be managed through that structure.
Thank you, Prime Minister. I want to turn, if I can, to Ufrida Ho from the Daily Maverick in South Africa, who we've got on the phone. Ufrida.
Thank you. If this is for the Executive Director, please, how do we reverse the losses and the risks you've highlighted, you know, with things like the increase in GBV and girl children out of school and the supply chain disruptions? Could you elaborate a little maybe on some of these actual strategies or projects and monitoring systems that maybe you'd like to see in place so that we do get back on track because of the whole COVID crisis by the time you guys have your next reporting period, please? Thank you.
Thanks for that. Winnie.
Oh, thank you for that question. First, rights matter, human rights matter. We are seeing the rights of people living with HIV, the various groups, like I mentioned, gay men, sex workers, transgender people, prisoners, migrants. These are the groups, amongst others, who are left behind and then who continue transmitting the virus, whether it is COVID or HIV. The fact that certain people in society are ignored, neglected, marginalized, that is why an epidemic doesn't get eradicated. So the human rights of these groups of people matter by giving them their right, non-discrimination, non-stigmatization, decriminalization. These are important towards getting them to reach services, to be served and to be equal like everybody else. So human rights matter. We must push harder on the human rights, the human right to health of everyone. That's one. Two, we said many times, we've learned from the HIV epidemic that an epidemic isn't just a health issue. It is more than just health. It is about communities. It is about the whole of society. It's about economy. It's about vulnerabilities and inequalities. So we insist on a multi-sectoral approach to this problem. So not just we want public health measures, but think about the economic impacts on different groups of people. Think about society and the need to change behavior and who's going to drive that. So put communities at the center and let them find the solutions for themselves, whether it's social distancing. Who can tell market women in Africa how to social distance? Only themselves. Only themselves know how to solve that. So put communities at the center, make the approaches multi-sectoral, not just driving public health measures irrespective of other factors. That's a second solution. The third one is the resourcing. The resourcing. We have to put more resources into the COVID. You can't say that you take from one disease to fight another one. This is a new disease. It needs its resources, and we must maintain the investment in other illnesses. I know this is hard. One of the ways we have been fighting to help the poorer countries is fighting for more longer-term debt relief so that they have more space, fiscal space, to pump money into a new disease and not take away from other priorities. Many countries need more debt relief over a longer time, not just these few months they've been given, and deeper debt relief, special drawing rights from the IFIs. We need better measures, more measures to put money in the hands of governments to deal with these things. These are some of, and above all for women and girls, to fight these inequalities between women and girls. Put girls in school. Roll out secondary education for all kids. This is critical. If we are to reduce vulnerability of girls, we must get them in the safe space of school. So some of these are structural barriers that need resolution, not just because of this crisis, but for the wider impacts on society.
Thanks for that. We have a question from Angel Menembu in Indonesia. The question is, how can the private sector step up in the fight against HIV/AIDS?
That's a good one for the Prime Minister.
That is a very good one, Prime Minister. You mentioned your experience before coming into politics, I think, as leading business response. What were the lessons from that experience? How can business really help progress this fight?
I think what is important is that the private sector should encourage that all businesses must have HIV and AIDS policies. And the policy basically will articulate how the company and the organization will manage issues of HIV and AIDS. Secondly, that the companies should set aside money or budget for HIV and AIDS initiatives, so that the employees or HIV and AIDS in the workplace can be properly attended to. And this is basically what we were doing as in the private sector, the board that I was chairing, working with various organizations, partnering with government, and also learning from other countries in terms of best practices, and ways to encouraging the businesses to really embrace things like, for instance, testing, periodic testing of all employees, so that you know the prevalence rate in your organization, so that you can take corrective action. Obviously, it took a while for companies to embrace this, because people, generally wouldn't want to spend money. But the whole campaign around welfare in the workplace, and in particular the fight against HIV and AIDS, really was prioritized. And over the years, we saw really companies embracing the new approaches in the fight against HIV. But what is important is that the employer organizations at a national level should drive these programs and really force companies, challenge companies to embrace and do something about HIV and AIDS. Eradication of stigmatization in the workplace is very, very important.
Thank you, Prime Minister. Winnie, what can businesses do to really get behind this fight?
Yes, in addition to the excellent suggestions by the Prime Minister, I want to raise two other issues. One, a responsible company, the first responsibility of that company is to pay its taxes. Developing countries lose up to $100 billion in tax dodging by companies. So paying their fair share of taxes is the first biggest responsibilities of companies, because it is that money that then can be deployed for health, for education, and other priorities, public priorities. We need a big corporate tax reform to get developing countries to get their share of resources to solve problems. The second one is this system. Currently, the fact that we have huge demand, global demand, this is a disease that's affecting every country. There's huge demand for commodities for COVID, starting with the PPE, the gloves, all the protection equipment, to test kits, and now there's a race towards a vaccine and even some treatments. So there is a whole market there for producing goods for COVID. It's important that companies, and now I'm speaking directly to companies in India and in Brazil, in the countries that manufacture drugs, that it's so important that they don't drop the ball on HIV commodities, because there are now new commodities that might be fetching a higher profit. We have to understand that this is about the health of people, the lives of people. Profits can't always come first. This sounds like, you can sound a bit crazy when you talk about lives coming before profits, because we live in such a world that has become so used to neoliberalism that profits now sound more important than human life, but they are not. I assert lives matter more than profit. So you can take less profit, but continue to make a profit and to serve all diseases. So this is important, not to drop the ball on HIV commodities. But even more importantly, this is a time we must challenge this model where intellectual property protection is as important as the right to life. This cannot be right, that companies can use intellectual property protection to maintain a monopoly on the production of a life-saving treatment and have people die because they have a so-called right to their intellectual property. This can't be right. HIV, people living with HIV in countries like Africa, Latin America, and other countries waited from 1996 for another 10 years before prices came down from $10,000 per person per year down to $100 per person per year before they could save their lives. Millions died. This shouldn't happen now in the case of COVID, especially because we have found that now you need public money to get to a vaccine. So since the whole system of intellectual property and companies owning the right has collapsed, let's go now to a system where we protect lives, we regulate how companies earn their profits, and we make sure that they can get their costs back, but everybody is served equally with treatment and with vaccines and with all health technologies. As you can see, I'm passionate about that.
We've got a question from Henrietta Bornkamp from Germany's ARD, who asks, is the corona pandemic challenging access to a health treatment for HIV patients in Germany and Western Europe? Are you seeing that the challenge for people in the most developed economies suffering from the crisis in terms of access to treatment?
For the developing economy, for the rich countries, the message to them is to behave well. What we are seeing is vaccine nationalism now in the context of COVID. They are jumping the queue, booking up supplies for their own people, so that once again, the people in the poorer countries will be dying, waiting in line to be served. This is wrong. What we are saying is that let's all line up behind the WHO-led process of developing a pool, a COVID technology access pool, where information, scientific knowledge is shared, and we accelerate towards getting a vaccine by sharing open science method. We get a vaccine, and then it is produced across all regions. We get the companies that have the capacity to produce. They produce it, they are licensed to produce for all countries. And let's put our health workers first. Let them be vaccinated first before rich people who happen not to be at risk are vaccinated just because they happen to be from rich countries. Put health workers globally first, put people with infections that make them more vulnerable first, and then serve the rest of the world. We cannot have rich countries buying up everything and leaving our people who serve as health workers to die. So to rich countries, we are saying that the message is, let's have a global solution to a global problem. Let's keep the money flowing for all diseases. The aid that you give today must not be shifted to solve one problem and abandon other problems. Let us have a considered approach that's a global approach to all diseases.
Thanks, Winnie. We have Caitlin Mann on the line. We're nearly at the close of our briefing. We've got about 5 minutes left. Caitlin, can you put your questions, please?
Hello, yep, Caitlin from Revert here. You've mentioned, a few of you have mentioned that there has been a redirection of funds from HIV program to COVID programming, and I'm wondering what the real impact on the ground, what will be the real impact on the ground, and is that going to be affecting treatment programming, or is it going to be programming for prevention? Specifically, I guess in Eswatini, but I guess if UNAIDS could comment more generally on what's happening in sub-Saharan Africa.
We have been monitoring this, and we are seeing indeed the disruptions, and we've done some modeling, and we've come up with some quite alarming figures, and we are putting a caution. If the disruptions that we are seeing become so severe and remain so severe for another 6 months, and these are disruptions in treatment, but we're also seeing them on prevention services, we're seeing an additional 500,000 AIDS-related deaths, an additional to what is happening now, an additional 500,000 AIDS-related deaths in this year and next year. That's huge. We are also seeing a reversal. We could have a reversal in mother-to-child transmission of HIV that would take us back to where we were 10 years ago, 2010. So in terms of the impacts, if we go on with severe disruptions for another 6 months, the impact in sub-Saharan Africa is huge and could also be just as bad in the other regions.
Prime Minister, perhaps you can comment on whether or not it's treatment programs or prevention programs that are likely to be hardest hit with some of the financial issues affecting HIV and AIDS right now with the pandemic.
Yes, I think the executive director indicated in her earlier remarks that what we are seeing is that countries are struggling to access drugs for treatment because of all the lockdowns and so on. In fact, we as Eswatini were greatly affected because we were importing drugs from one particular country, and that country, after the COVID-19 started, they basically locked down and they stopped exportation of medication to other countries. So immediately we got affected. Fortunately, we had stock in country. So it's definitely it's going to affect us from a treatment point of view, and also from a prevention point of view, because they focus, the health system has limited resources in terms of human resources as well as financial resources. So we are finding difficulty now to focus on both of these epidemics at the same time. At the moment, the biasness is definitely more towards COVID-19 because of the fact that it's a newer pandemic and it's growing pretty fast. So yes, I think for us it really we are seeing an effect both on treatment as well as on prevention, and we are monitoring the situation very, very closely so that we can take appropriate action going forward.
Prime Minister, thank you very much. And our thanks too to Violeta Ros for joining us from Bolivia. We're shortly going to be closing our update session, but I want to close with the last words from Winnie Byanyima. And Winnie, perhaps as you conclude the report launch today, one of the questions that's come in from a number of different journalists, including Max Jakubowski from Cointelegraph, is how can emerging technologies help in this battle against HIV/AIDS? Is there a role for technology to step up and help? And then perhaps can you give us some final thoughts as we end today's briefing?
Thank you. Well, first, I want to end on a note of optimism because we've made huge progress globally against HIV/AIDS. We have treatments that can put people on, it's a manageable disease. You can be on treatment and live well, productively for a very long time and live as long as anybody else. So we have treatments. We also have prevention, many methods of prevention. We need more scientific innovation, definitely, to make all this as easily accessible for everybody so that the science meets people where they are. Definitely, there's room for more innovation. That's why I answer your question that, yes, technology, we need more of it. We need more scientific innovation for children, for young people, for sex workers. Everyone has a particular need, and their need must be met with the right health technology. So we need technology. However, I want to come back to the caution that where we are not achieving progress, where we are achieving progress is because they reach everybody. Where we are not, it's because rights are not respected. COVID has hit everybody, and there's a focus on COVID because rich and poor, powerful and not are all affected. But HIV is being dropped because it is now a disease of those with the weakest rights, the most marginalized, the most silenced. We must respect their rights. That is how we will solve this. respect their rights, put resources to their health as we put for others. That would be my last point, that we can't beat AIDS, but human rights matter. Of everybody, of all vulnerable groups. Human rights matter, resources matter, and an approach that is putting communities at the center of fighting an epidemic matters. We can't beat AIDS. Thank you so much.
Thank you. Just a reminder to everyone that there's an embargo for another 4.5 hours on today's update. Thanks to everyone who came in with questions. Special thanks to the Prime Minister for joining from Eswatini, to Violeta Ross for joining from Bolivia, and to our chair of today's briefing, Winnie Byanyima, Executive Director of UNAIDS. From the World Economic Forum in Geneva, have a good rest of your day. Thank you for joining.
Thank you, Prime Minister.